8 minutes. Disgusting.
Medicare for all, that's the topic we're debating for the next 2 months, September and October. Medicare for all. So, today's agenda. We're gonna go over the topic history, why we're debating the topic, what's important about the topic, and at the end, I'm gonna give you some research tips for how to research whenever you're writing arguments and creating blogs. So, first, let's talk about the topic background and why it's so important. So, why Medicare for all? Why do you think that this is such a hot topic issue right now? I'm asking a question. Josh.
So Bernie Sanders brought this up for Medicare for all, and healthcare is a very important issue, and it's still the election.
Yes, that is important. So, big statistic. Nearly 60 million people are using Medicare right now.
Write this down.
Yeah, 60 million people are using Medicare right now. And that's nearly 20% of the United States population. So it's really important that we understand why Medicare for all is a big topic and why we're debating it right now. Also, we're literally in the middle of a pandemic, so healthcare is a really, really important issue that we're talking about, and Medicare for all is just really important to why we're debating what we're debating. So let's talk about the introduction. So this is a resolution word for word. The United States federal government should enact the Medicare for All Act of 2019. Now, the first thing you do whenever you read a new resolution is you define words that don't really make sense to you. So, any of the novice, can you tell me what words you think we should define? Or like words that don't make sense to you from this
Or that
resolution.
you don't use in your everyday vocabulary.
I don't use that.
Logan, what word did you just say?
Federal.
Federal.
I don't use that ever.
Federal government. That's a big thing. That's really important to remember. Any other words? I know you probably don't use the word enact every day.
What does enact mean?
What does enact mean? Or Medicare, or Medicare for all. So let's go over the definitions. Here, I have the definition for all the important terms in the resolution that you're going to want to know. So, enact. It means to establish by legal and authoritative act. And as you can see, I've linked these. Well, everyone knows what the United States government is, but I've linked the rest of the definitions so that if you need to go back, you can just click them and link them. And obviously, Medicare already exists. It's the federal health insurance program for people that are 65 years or older, and it also includes people with like disabilities that are younger than 65. So it's a health insurance program that people use. And Medicare for All is the thing that we're debating. It's the national health insurance program that's available right now for the elderly, but the plan is going to be spread out to everyone in the United States. And that's everyone living in the United States, whether you're a citizen or not. And obviously the United States federal government is the actor that's making the decision to implement the Medicare for All Act. So I'll give you like a few minutes or like a while to write all of these definitions down, because you're going to want to know what all of these mean. Yes.
Okay, so for the Medicare for All Act, it could only apply to all citizens, or all people in the US. How does that apply to undocumented immigrants?
So that's actually one of like the arguments. It's kind of difficult to identify, like if you're undocumented in the United States. That's one of the like neg arguments that, oh, everyone doesn't really actually get Medicare for all. So the way that the bill is outlined right now, it just establishes that like literally the words are everyone living in the United States. There's not really like a basis for how to determine like how you find people that are undocumented or like not citizens or anything like that. It's just anyone living in the United States.
Which is what really gonna have to be clarified in round on a round to round basis, because any side can take that for their stance on the argument. Yes, sir.
So then Medicare for all, that also include like illegal immigrants.
Yeah, like I don't know if illegal, like undocumented. That's yeah, we'll use that word, undocumented immigrants.
Alright, I didn't think
Yeah, so these are the types of Medicare. You'll notice that Part C isn't anywhere on here. That's because Part C is super, super complex, and you're probably not going to talk about it at all. So let's talk about the parts that are really important in Medicare right now. So Part A, it's focused on the hospital aspect. So if you break your leg and you go to a hospital, Medicare will cover some of your hospital expenses. So an example of that is if you're in a nursing facility and they care for you, your Medicare insurance program will cover that. Part B is focused on after you go to a hospital. So it's on doctor services and preventative services. So if your doctor tells you, if after you go to the hospital and your doctor tells you, oh, we need to get a scan for your leg to see where exactly it's broken or things like that, that's where Part B of Medicare kicks in. It's for medical supplies, services provided by doctors, all of those important things after you leave or after you're done with hospital costs. And Part D is super simple to understand. It's coverage for prescription drugs. So if you break your leg and you need some pain medication, Medicare will cover that. But it's also important to know when you're debating to know what's not covered under the Medicare program. Long-term care, if you're in an old, if you're admitted to if you develop dementia and you're admitted to a hospital for a long amount of time, that's not covered under Medicare. Most dental care is also not covered under Medicare. It's really not covered under a lot of insurance programs. Cosmetic surgery and acupuncture. So you'll notice that the last three things on here are not things that generally happen a lot. Not everyone gets cosmetic surgery and not everyone has acupuncture. So the important things are covered under Medicare through Part A, B, and D.
So what about people in a coma?
That's not covered because that's long-term care. So, let's see. Logan, would you like to give me an example of what Part A would cover under Medicare? So if it's focusing on hospital aspects, give me a situation of what Part A would cover. Speak louder, I can't hear you.
If you get Alzheimer's, whatever, I don't know how that works.
And you just have to go to the hospital for a checkup or something, right?
I don't know.
He said if you get Alzheimer's.
Okay, so that depends because again, long-term care is not covered. So try again, just give me another example. Remember, hospital aspects. I already gave you an example. It's care in a nursing facility. So give me another one.
I don't know.
Just anything about a hospital aspect.
Like a checkup.
Like what?
A checkup? Like a doctor?
Yeah, sure. A doctor's checkup. Great. That's part of Medicare Part A. Good job.
Rather
Logan.
myself.
Charlie, tell me an example of Part B.
So if you needed to go in for a few checkups about your broken elbow or something, and they needed to see how your healing is progressing.
Exactly. Great example. And finally, Part D. Sarah, give me an example of Part D. Prescription drug coverage. Just
Oh, so medicine. So
yeah.
you can get
Medicine. Exactly.
Good.
Great. Let's move on. So there are some key. Oh yes, you have a.
Sorry, okay, yeah, back to the other one. Since it's all under Medicare-For-All Act,
Yeah.
is there gonna be do you think that there will be pros and cons that we'll talk about specific parts of Medicare-For-All, maybe something that's lacking in Part A or?
I think once you get into the more complex issues, people will start focusing on the specific parts. But I know that a lot of people are going to focus on Part D because it provides prescription drug coverage, and that's really, really expensive. Prescription drugs are really expensive.
Yes, and it says Medicare for all, they lower the stuff.
Yeah, so that's in any case, Part D is going to be super emphasized on, but that's only for like if you're getting into really complex debates, which we're not really.
I
Yeah.
have, sorry, I
Yeah.
have one question on the previous slide. So, part A, an
Mhm.
example is care in a nursing facility is covered?
Yeah. So okay,
So I think-
I should probably elaborate
Well,
on
what's
that.
confusing to me is, so that's covered, but
Long-term
long-term care is not,
Yeah, so like when I mean care in a nursing facility, again, long-term care is like greater than like like
So part A, we focus on PT.
it's like the hospital cost. When I mean care in a nursing facility, I mean like you go there for a day or like you go there for 2 days. So like Ahmad just explained like physical therapy.
So like rehab, get
Right,
you, so you
right.
can go back home
Right, exactly. Long-term care is when you're like there for
for the duration.
right, exactly. So yeah, I should probably
It's
explain
okay, I
that a
just
little
was
bit.
thinking that was confusing.
Yeah, okay. Glad you cleared that up. Is everyone ready to move on? These are some key components you need to know about the Medicare-For-All Act. So again, it's a single federal program that applies to all residents living in the United States. It's going to replace all private insurance. So that's like Medicaid, other forms of private insurance. Like everything is gone and it's replaced with Medicare. And it's financed by taxes. So you won't have to pay like a premium payment or a monthly payment. And it's enrolled at birth for life.
Actually, I have to mention this, Bernie's like 2019 plan actually says 9 different ways to finance it, which include premiums. So that could be something. I don't know.
Both Sanders and Jayapol's like
I don't know
are
if
financed by taxes.
I can show you the PDF I found off of Bernie's website and show you it because I know there's like 9.
It might have changed. I'm looking at the most recent
Okay.
one from last
I'll
year.
show you it later. Maybe I'm just
Yeah. Yeah, I got that. I got that from. There was a similar bill in the House from Representative Jayapol. That's like super close to Sanders.
Yeah.
So yeah.
I'll send you the PDF.
Yeah,
You can
okay.
look at it.
So those are some key components to know about Medicare-For-All. I'm gonna let everyone finish writing.
Oh, it's so nice.
Don't worry, if you don't understand everything right now, we are gonna have a giant discussion at the end about Medicare and why it's important. That should clear some things.
Right.
Yeah.
Yeah, this is also kind of an thing. So like, you think since it's a role at birth, if I would say like a doctor, that would
Yeah,
probably
they're
apply.
like it's. I know Bernie's like super like supposed to be super progressive and whatever, but there's really not that many things in his plan that outline like if you're like an immigrant that comes in later or like undocumented or like even after you become a citizen or if you're on a green card or like a worker visa or something like. It's just like grouped under everyone in the United States. Yeah, there's not really like subsections for how you get here or anything. So these are some things to keep in mind when you're not only doing research about Medicare-For-All, but also just understanding how Medicare-For-All works. So you're going to want to understand, is the bill effective? Are doctors, after Medicare-For-All is passed, are they skilled enough to keep up with what happens? Does Medicare-For-All lower the chance of people going to poverty or losing insurance or losing health care? You're going to want to understand some of the consequences after this plan is passed. And do they deter hardship? And what I mean by that, what I mean by hardship is, does it make the standard of living or the quality of life better for everyone if we pass this act? And finally, are they better at fixing the healthcare system that's broken in the United States right now? That's one of the most important things to focus on whenever you're studying and understanding Medicare-For-All.
And you may have already said this, but Medicare is currently just for 65
Yeah.
and up. So, and if anyone's like, whoa,
Yeah.
so that's the change,
Yeah, many-
65 and up, or if you're 65, if you're under 65, you have to have a disability.
Yeah, right, so,
You may have
yeah,
rights.
that's like something that people probably didn't know. Medicare is already a thing, like for people that are older than 65 or have disabilities. The plan makes Medicare available to everyone in the United States. So like literally everyone in the United States, not just if you're elderly or you have disabilities.
And Medicaid is income-based, so
Yes.
just don't interchange those
Yes,
words. for
I will go
totally
over,
different.
I will give you a handy dandy tip to differentiate between Medicare and Medicaid. I see people reading, this is good. No keeping is good.
That could be interesting.
Like the
I-
communism idea, or like socialism.
Well,
Cause like nobody would know how to respond to that.
That's
Our
kinda-
numbers
that's
would have to
kinda
understand it,
complex.
though.
Yeah,
We'll think about it in our case.
I'm gonna talk to you all about novice cases.
I'll give you my ideas already.
Yeah, part has outlined things.
Yeah.
Here's an
So,
outline.
this is a little chart for what you get under the Medicare-For-All Act. I know it's a lot to read right now, but I'll share this presentation with you, like in Google Classroom, so you can just go back to the slide and look at it. The things you need to understand from here, obviously eligibility, like I said, everyone from the United States gets access to it. The benefits, it gets rid of all private healthcare and provides everyone with the balanced healthcare insurance program. And yeah, one of the most important things to understand is the timeline. This Medicare-For-All bill, when it's passed, will take 4 years to go fully into effect, which is something that you're going to want to take into
So
knowledge.
any impacts that the Av states cannot happen until the next 4 years.
Yeah, so whenever you're researching on benefits or negatives of Medicare-For-All, you're gonna want to keep in mind that not all the benefits that they talk about here happen until 4 years after the plan is passed. But yeah, anything that you need from this list, I'll share it with you. You can just come back to the slide. The important things are eligibility, benefits, and timeline. So what changes? I'm gonna write stuff down because this is important. So under the current system that we have right now,
Very basic.
I think there are so many better arguments that you could run other than those.
Medicaid,
Okay, if we go talking.
Medicare,
Yeah,
and then private insurance. So under the healthcare system we have right now, the healthcare system is split up into Medicare, Medicaid, other expenses, and then private insurance. After the bill passes, everything is taken away and everything turns into Medicare. So Medicaid disappears, private insurance disappears. You can draw this down if you want to, but everything goes away and Medicare replaces all of it. So that's any small plans, plans by private businesses, Medicaid for low-income families. Everything is replaced and switches over to Medicare. Yes.
So it's still in Medicare, except under what's not covered, that would still be existing, obviously.
Yeah, the things that are not covered are either going to be I'm pretty sure they're going to be out of cost payments. Yeah. Okay, so these are just some generalities, things you should probably know when doing research. So the whole idea of insurance, does everyone know what insurance is? Yeah?
Traffic, great traffic.
Yeah, Tucker, what is insurance? I don't know, I accidentally clicked a button. I apologize, I'm very sorry.
Wait, what?
Yeah,
Okay.
Question is, what is insurance?
yeah, what is insurance?
It's when another party pays for something that happened to you.
Right, so like, you pay, and then when something bad happens, they cover some of the cost, right? That's how insurance works. So, I know these numbers don't add up to 100%, but there's a good reason for that. So we've actually, like, as a country, the United States has been doing really, really well on keeping a lot of people insured. Like 91.2% of everyone in the United States is insured, and that's a really good thing because only 8% or 8.8% are uninsured. The problem with the insurance that we have in the United States right now is that people, even though they're insured, they're underinsured, which means that they have to pay more even though they already have insurance. So 26% of the people that have insurance are underinsured. And what I mean by underinsured is like their insurance plan will be like, you have to pay like $5,000 first before we cover any of the expenses. So super high deductibles and things like that. And by implementing Medicare-For-All, you fix this and you fix that because everyone gets the same insurance plan. I'm going, that's the
So they might have like catastrophic insurance, basically. So it's like if you have cancer or you get in a terrible accident or something, it's like, oh, but like you said, it's like you're gonna pay $10,000 out of pocket first, and then they'll help you out.
Right, so like someone that like is insured properly, like let's say you have Geico for car insurance and you get into a wreck, they'll be like, oh, you can, I'm just using like random numbers here, if the total cost is like $10,000, they'll be like, oh, you can like pay like $700 and then we'll cover the rest. That's like good insurance. Bad insurance or underinsurance is when the cost is like $10,000, but they're like, oh yeah, you have to pay like $6,000 before we actually pitch in for the rest of the things that we have to pay. So this is a really big problem, and Medicare-For-All could fix that. So let's move on to some of the terminology. I'm pretty sure being like high school freshmen, you probably don't understand what any of these words mean.
Even if you take personal finance, you still don't know what they mean.
Yeah, probably even if you take personal finance. So what is a premium? A premium is like a cost that, if you don't know, your parents for like health insurance are paying a premium either every month or like every year to like make sure you're covered under insurance. So like, let's say I am an adult, which I'm not, and I'm paying like $500, like or like $200 every month for health insurance. That would be a premium. The premium is the monthly or yearly payment you pay to make sure you have insurance. That is, yeah.
Yeah, it is your cost to have insurance.
Yeah.
Yep. What you pay.
What is happening outside?
It's Missouri.
Anything can happen,
Anything
except for snow in December.
Yeah, except for snow. Yes.
Man,
Yeah.
it snowed in July one year.
I do remember that. I do remember that.
And guys, most people, even if you have benefits at your job, you still often have a premium. So for like teachers,
Yeah.
it's like we pay part of the cost and then our employer, the school district, pays part of the cost. So even if your employer covers part of your premium, usually most people have some out-of-pocket cost to cover that premium.
And the whole idea of paying a premium is how insurance companies work, right? So let's say there's a new insurance company with 10 people. Are you leaving? Okay, bye. If all of those 10 people from this new insurance company are paying $100 per month, and let's say 6 months after this insurance company was created, one of those 10 people like gets into a car accident and like breaks their wrist or something, the money that the insurance company took from all 10 of those people will help cover that one person's like injury or medical expenses. That's how like insurance works. So the next term on here is a deductible. The deductible is how much you have to pay before the insurance kicks in. So like, let's say the total cost of your hospital bill is $10,000. The deductible would be like $1,000, and then the insurance would cover the rest. So it's the amount that you have to pitch in before your insurance company is like, oh yeah, let's cover the rest of, yeah, let's cover the rest.
Yeah. And, yeah, I don't want to get too complicated, but yep, that's right.
And copays are kind of confusing. They're kind of like deductibles, but you pay copays, let's see if I'm saying this right. Like, when you go to the hospital, you would like pay 20% of the entire bill, and the insurance company would cover 80%. That's like how a copay works, right?
Yeah, or sometimes it's a set copay, like every time you get a prescription drug, it's $10, or every time you go to urgent care, it's $50. Every
Yeah.
time you go to the ER, it's $500. So sometimes it's a set amount, sometimes it's a percentage.
Yeah.
That's why you don't take an ambulance unless you absolutely.
Yeah, that's true.
That's why you go before you need the ambulance.
Yes. Preventative measures. So let's talk about some research tips. Whenever you're researching for arguments and cards that you're going to be cutting over the course of the next few weeks, you need to understand the difference between Medicare and Medicaid. An easy way to remember this is Medicare, right now, Medicare is care for the elderly people. And Medicaid is to aid those in need. So like low-income families, that's what Medicaid is for. We're focusing on this, because that's what's important, that's what's in the bill. We're focusing on Medicare. And you should write this down, because it's like a tip on how to know which one you're actually researching and studying for. If the like article you're reading mentions like aid for low income, it's probably referring to Medicaid. You're going to want to research for Medicare. That is what's most important.
Low income and disability.
Yeah. So these are the bills that Medicare-For-All are under. The staple bill that was like introduced in oh my goodness. The staple bill that was introduced in 2019 is the one from Bernie Sanders, and that's the Medicare-For-All Act of 2019. That's the bill that we're talking about. Like, this is the bill. The bill from Representative Jayapal is technically the same thing as Bernie Sanders' bill, except it was passed in the House of Representatives and not the Senate. So whenever you're doing research about Medicare-For-All, like if it's specific to a bill or specific to a piece of legislation, make sure it's about Representative Jayapal or Senator Sanders. There are like a lot of other bills and legislation out there, but they're not Medicare-For-All. They're Medicare for some. These are the only like two bills that provide coverage to everyone in the United States. And like, as an example, the first two are Medicare-For-All bills. This is from Jayapal and this is from Sanders. All Americans get coverage. It requires a tax increase, and the government regulates the prices. So these two are like incredibly similar. They're almost the same thing. The Medicare for America bill is like way different than what we're talking about. So because it like provides everything. So whenever we're talking about Medicare for All, Sanders bill and Representative Jayapal's bill. And that's just for research. Like obviously, if you're researching for Medicare for All and you come across like a separate bill, just keep in mind that it's probably not going to be useful. So, now that you've learned a lot about Medicare for All, let's discuss. Varsity, I'm going to call upon you to start a discussion with the novice, because team bonding is good.
Yeah.